welcome back to another episode of Worth a Listen, a financial podcast for your everyday life. I am Chris Haney, and today joining me is Kimberly O'Toole. Hi, Kimberly. How are you doing today?
Great, Chris. Thank you.
Good. Well, welcome aboard. Tell us a little bit about yourself. Who are you, and what do you do?
As you said, I'm Kimberly O'Toole. I am a benefits consultant. I work for CU Benefits Alliance. We are a consulting firm that work primarily with credit unions all across the country and help them with their benefits for their group coverage, their medical, dental, vision, disability, that type of product.
So it looks like today's episode is going to be talking nothing about or everything about benefits, huh?
My favorite topic.
Your favorite topic, not my favorite topic. Probably not the most favorite topic of consumers. When I think about benefits, it's kind of a mystery to me sometimes. As a consumer, once a year, I go through open enrollment where my employer presents me benefits and I choose them, and that's about it. But there's a lot more to it, isn't there?
Of course.
There's a whole lot more to it. There's a lot of things that employers do on the back end to bring those benefits to each and every employee, right?
Exactly.
So today what I want to talk about is I want to talk about kind of the medical industry as a whole, kind of what you as an expert see in that industry. And then for our listeners, I want to talk a little bit about what health insurance is, kind of the differences between health plans, what you see coming in trends in the health industry. And then we're going to probably talk a little bit about what consumers, what I can do, what everyone can do to make our benefit plans and our medical plans really work well for us. Okay, so let's go ahead and get started. One of the very first questions I'm dying to ask you, and it's probably a question that most people don't even know to ask, but when I get my benefits and I see like on TV, people talk about HMOs and PPOs. What the heck is an HMO? What's a PPO? And what's the difference between the two?
So an HMO is obviously an acronym for Healthcare Maintenance Organization, and that is different than a PPO, which was a preferred provider organization. So the main difference between the two is that the HMO is what you might call a closed network of providers. You have a very limited network of providers that you can see, and you must see providers within that network. I think the one that comes to mind with most people is Kaiser. Kaiser is an HMO type product. It is you're only allowed to go to those providers that are listed in the Kaiser network. You are unable to go outside of the network except for very limited circumstances. The exchange on that is that you have very managed care. You have to pick a primary provider, and they direct your care through the whole process. If you need to see a specialist, you start with your primary care, and they refer you to a specialist. So somebody is in complete control of your health care and knows as much as they can about you so they can direct your care.
Interesting.
And the primary or the PPO plans, those plans, you get to select everything you want. You can select the provider in or out of network. Of course, we always recommend in network. Select your provider, and you do not need a referral to a specialist. You can pick a specialist out of the book and just go ahead and go and see that specialist. In the HMO environment, most of the time, the benefit design is lots of copays, so you know exactly what you're going to pay for each service. The PPO environment, there are some copays, maybe for an office visit or your pharmacy medications, but other procedures you may get done are typically a deductible that you have to meet and then some cost sharing with the insurance carrier. Maybe you pay 20% of a bill and they pay 80%.
So when employers look at choosing plans, what makes an employer lean towards a PPO versus an HMO or vice versa?
There's probably a lot of different pieces to look at in that consideration. Most employers want to provide the most choice for their employees as possible that they can afford to provide. And I would say that falls into the PPO side. It's typically a larger network, and you just have the availability to see whomever you want and not have to get a specialist referral. The HMO side, you really have to change providers. So it's hard to get into the plan as a new client, and it's hard to get out of the plan because everyone then must change carriers, or pardon me, providers. Everyone has to change a provider because, for example, the HMO network may only have those providers in that network.
So why even offer an HMO if it's so restrictive?
The cost can be much more attainable for a company.
I
Not
see.
always, but it
Okay.
can be much more attainable and sustainable for a company. And again, the employees that are in it and know the system and can work through that system, like the copay idea. They know exactly what they're going to pay for every service.
I see. Okay. And so other than like structurally designed in network, out of network doctors, are there going to be a difference in who is in those networks? So I'm thinking about, like, let's say I have a PPO plan with one of the major medical industries, and then I have a HMO with the same company. I want to go to one doctor. Will both of those plans have that doctor in network?
I would have to look at the details of the plan, but typically I would say some of them will be the same provider, but the HMO side is going to be a very narrow, restrictive network. And as long as you're okay working within that network, you get those benefits of probably lower premiums, contributions by employees, and the copay design typically.
Okay. So sometimes, as our listeners are thinking through kind of benefits, and when their mind is thinking about what benefits to choose, um, how would a consumer know whether or not their doctor is in network?
We always recommend when looking at changing carriers or providers that everyone access their website and search for their existing providers, their doctors that they're currently using. You can always search from typically the main page of any insurance carrier. That's a really big piece to make sure your provider is in network for a lot of people. Now, some people that don't go to the doctor very often may not care, and they're just tell me which network I'm in, I'll pick a doctor, and that's fine. So that's the biggest piece. And then whenever we do look at changing carriers within a company, we sometimes can access existing carriers that are being utilized. So maybe for the last 12 or 18 months, I can get a list of all the providers that a company has been using, and then I can run that comparison against the other carriers to see the comparison and the overlap.
It's really interesting you mentioned that, because that does remind me, when I think you and I have even done this before, when we look at benefits and then we decide whether or not we want to use another carrier. I forget the name of the report, but there is a report that we look at that shows the difference in network and out of network for carriers.
Hmm.
And so I know on the back end, when employers look at plans, we're also looking at the impact of changing carriers to our population as well. So whether or not I make an impact or a change from a certain carrier to a new carrier to try to mitigate some costs or things like that. We also have to think about coverage networks too. You know, when we look at coverage networks, do you in the industry as a whole, do you see coverage networks increasing or kind of decreasing? When I guess what I mean by that is covered cost of medical procedures and things like that. Do you see plans expanding that, or contracting that as cost increase throughout the nation?
Well, I don't see any costs coming down, unfortunately, on the horizon. The way our health care system is set up, the cost of care does fluctuate from provider to provider, from facility to hospital. So those are things that we should look at in terms of cost. Then in terms of network, lots of carriers are looking at narrowing some networks and offering that as a product to purchase at a less expensive premium. But again, it's a less expensive premium, but it's restricting your members to who they can see for their services. I not restricting coverage or services that are covered, am I seeing, but what I am seeing is more items going through prior authorization. So that list grows so that providers aren't just, asking for the most expensive test, an MRI, when maybe an X-ray is sufficient, something like that, because the cost difference in those two procedures is significant. So it doesn't only impact the employee or the member on the plan, but it impacts the business that's paying typically the majority of that coverage.
So you said a word that I think I want you to explain a little more, but you said pre-authorization. What exactly is a pre-authorization and why is that important in the benefit world?
So the pre-authorization or prior authorization is when there's a procedure, typically it's a dollar amount that sets it, or something that could be complicated like a surgery. The provider or the doctor that the person is seeing submits that to the insurance carrier ahead of doing that procedure to make sure that they're going to approve it. What they're trying to prevent is the insurance company saying, no, that was not medically necessary. You could have done a less expensive procedure that has better outcomes. That's the idea of a prior authorization, is to make sure the correct procedure is being done for the correct situation before it's done, so that if there is an argument or a disagreement or a discussion that needs to happen, that can take place before the actual surgery or procedure is done. That way the member doesn't get a surprise decline or some of the services weren't covered. So it's a way to protect the patient as well as the plan.
Okay. And what are some common things you have to get pre-authorizations for?
Lots of plans require them for MRIs.
Okay.
Some don't, but lots do. Typically, any surgery that needs to be done just to make sure the situation calls for that type of a situation or type of a procedure. I'm trying to think of, for example, bariatric surgery would need to be prior authorized. There are very strict conditions that fall into that procedure. So it's typically the high dollar procedures that are being looked at ahead of time.
Okay. And you know, if I bought the plan and I'm in the plan and my knee surgery is covered in the plan and I got a bum knee, why do I have to get a pre-authorization for that particular surgery?
Again, it's a way to protect both the patient and the plan. I'm not saying that they're scrutinizing the criteria and looking for ways to not pay it. That's not what we're looking for. The carriers are typically, just like I said, looking to make sure that that knee x-ray shows that you actually need a surgery, as opposed to maybe physical therapy would really be the first choice.
It's almost like a collaboration then between the provider and the insurance company saying, hey, provider, we need to do this. Insurance company, but can we do it this way? Let's make a middle ground for the both of us to where we both, the patient gets their health corrected, fixed, back on the healthy track. We get our revenue and both people are happy. So that's kind of what you're saying here.
That's where I would like to think that it falls in.
Okay.
Yes, definitely. What's best? What's the best outcome? They may differ, the two sides, and many times they offer a peer-to-peer discussion as well. So the provider can actually get on the phone with someone from the insurance carrier, and that is a medical doctor, and they can talk through it. This is why I'm thinking this. Well, here's what I was thinking. And then they can, like you said, come to a consensus and then move forward.
I see. So I want to kind of take a step to the side, I guess, and I want to talk about something that I think everybody probably thinks about when it comes to benefits and obviously costs. I want to talk about the rising cost of insurance, medical, just in general. I read an article, I think it was last week. It was in the Temple Daily Telegram. They were talking about ACA benefits premiums increasing almost like 40, 50%. Around this time every year, I always see articles that talk about the rising cost of insurance and the rising cost of premiums. But, they're never going to go down. And what can we do as consumers to kind of mitigate that rising cost? I'm assuming you see the same thing in your area. The cost of coverage and everything is just skyrocketing. Can you talk a little bit about maybe what you see and why that's happening?
I can talk about it for sure. The actual reason why I think is very complicated. I can give very general reasons. Everything, as we know, inflation goes up every year, and healthcare is no exception. Every year, the providers want to charge more. The hospitals want to increase their costs because they're trying to spread that across increase prices for even Band-Aids, if you will. So that we have to think all the way down to all the different procedures and pieces that they have to purchase. If those are going up every year, the hospital and the provider also have to make up that difference. Plus, we all want to raise every year too. So that's included in that as well. Now, of course, when utilization is very high, that again is going to cost more. The insurance carrier, if it's a fully insured plan, has to make sure they're covering their expenses because they're the ones paying out the money. And they've already decided how much they're going to charge each client. And if through the year things just skyrocket out of control, they're going to have to make it up at the next renewal and make sure they charge again enough to cover their expenses. And then, of course, a profit. So it does go up. It's kind of a big circle that just, I don't know how we're going to control this and maybe rein it in a little bit. I think that's a bigger discussion. But ways to help control costs at the employee level or their family level are kind of things that I'm starting to hear more and more about. Some accountability, if you will, and some advocacy for yourself. When we have an insurance card and we take it into a doctor, we feel, well, this is going to be covered. This is a lab work that needs to be done. This procedure needs to be done. And we don't think generally beyond that. There are so many different pieces that we can affect if we take a minute and think about it. And I will give you one example who's actually, this happened to someone that I know. He went into the provider and he had a bum knee and needed to have an MRI done. The provider referred him, even though he doesn't need a referral, he referred him to this MRI facility. And before my friend actually just went there, made an appointment and went there, he went back onto his carrier's website. You can log into your own portal, so all the information specific to you. And he was able to search freestanding facilities. First of all, is the number one thing that we'll continue to talk about, but freestanding facilities for MRIs. He found the facility that his provider had recommended he go to, and it was going to be $1,800. He was searching through the list of different facilities and found one for the same procedure that was $400. Now, his particular coverage is a high deductible health plan. So for him, that's an immediate impact for him.
That's huge.
Yes. Those of us on a PPO plan, we may not care, but we need to start caring because our companies that we work for are ending up paying for this in the long run. So if all of us went to the facility that charged $1,800, our company is paying more for that service than if we all went to the $400 facility. Same test, same quality. And his provider actually asked him, why didn't you go where I asked you to go? And he said, well, here's the cost difference. And that was surprising to the provider. And I'm not surprised that it was because they can't know how much everything is going to cost. They can say, I like that facility, or I know someone over there, or it's close, it's in network, whatever that may be, but they're not going to be able to know the cost of all of those things or the cost of medications they're prescribing.
Well, okay, so costs. That actually brings up a really good point. You mentioned this person shopped around. That's unheard of. I don't hear people do that.
No, we don't. And it needs to happen more.
Well, I don't shop around for service. There's no menu. There's no pricing list. Like I can't go to the doctor and say, hey, can I get your menu of services so I know what to charge? So how as a consumer am I relegated to my my provider's website to find stuff like that?
With the ACA transparency and coverage rulings that have been handed down over these years, all of the carriers, so Blue Cross, United Healthcare, Aetna, they all have the ability for you to shop services and check out their cost on their websites. So if you create your profile on whatever carrier you are using for coverage, you can go in and shop different coverages. Maybe I want to look for an MRI service, since we're talking about that. And it'll bring up in-network providers closest to me, and it can give me an average cost. And it can show if that provider is charging more than what the average cost in the area is, around average or less. And that can help you make a decision. It just takes an extra moment to sit down and do that shopping, if you
Okay.
will. And I think, like, not to interrupt you, I think that the high deductible health plan, like I said, those are the first consumers that think the most about that because it's coming out of their pocketbook right away. But we also need PPO people that are enrolled in that plan to also do the shopping because ultimately that impacts the cost overall to the plan.
Okay. Well, here's another one. Here's another cost one. Why does an MRI cost $1,800 in one place, and then I can go 5 miles down the road and it's cost me $2,400? What gives? Is
Well,
it different machines? Am I getting a Sony MRI versus like a Toshiba MRI, Lexus versus
right. I mean, that's a very good question. The answer to that, I would have to ask individually to each of those facilities. Maybe a facility just built a brand new building and bought, 2 new machines or something. So they need to pay those off. Or maybe they just can't because people don't shop around. So that is the part that we're not used to taking into our own hands and doing that shopping like we do when we buy milk or bread or whatever that may be. Maybe we look at the cost difference between this brand and that brand, or a generic, if you will. We've just not been trained in the healthcare services side to explore different options and see if there are less expensive choices.
So you would say one of the most recommended actions that you would recommend a consumer in a health plan do is shop service. Don't just take your doctor's recommendation to go to a facility as, I guess, canon, if you will.
Yeah,
Shop around, look to see if there's another facility that that can provide you with, I'm assuming, in-network coverage
correct.
at a lower cost, and that provider will give me that cost. If I just call up, they'll say, "Hey, yes, we will give you an MRI at this rate."
Likely no.
Okay.
But the website will show roughly where their charges are because they submit those charges for payment. So the Blue Cross will know what this provider or what this facility is charging for that type of service. Partially now because they have to disclose it as part of this transparency ruling.
Okay. And is it major services that you're going to find costs to? What if I have the flu? I'm on a high deductible plan and I want to find a place where I can get the most economical visit. Is that available too?
I do believe that lots of the portals do have information down to that level. If they don't yet, I know they're supposed to pretty soon. So I can't remember the dates, to be honest with you, but all services are supposed to be available. We started with major services, so the MRIs or I'm drawing blanks on other services, but those expensive type knee surgeries, those types of things that you could search, colonoscopies even, you could search even though they're covered at 100% if it's preventive. If it's not preventive, you have to pay for that service. So the bigger services were originally on the websites, but now they are trickling down to almost every service now.
Okay, that's fantastic. So if you were to give kind of a recommendation to listeners, it would be that
100%. And
website.
the other piece of that is hospitals always charge more for the same service that you could get from a freestanding facility. So if I got lab work drawn in a hospital, it's going to cost 2 or 3 times as much as it does from a lab that's down the street in a freestanding facility. So that goes the same for MRIs, for anything that you can get not at a hospital. I always recommend that. Obviously, if you're admitted to the hospital, that's different. But whenever you're seeking care, if you go to the hospital, just know it's going to cost 2 or 3 times more, at least.
Yeah, so that's another thing too. Hospital, urgent care, doctor's office, our primary physician, if you will. So when I think about those, there's probably different costs associated with those 3 different facilities. Being hospital, ER, most expensive. I would say maybe urgent care kind of sits there in the middle, and then primary
Exactly.
is least costly on that list. So tell me why I would go to the hospital versus urgent care. What's the use of urgent care?
Urgent care should be just that, actually, something that is urgent, but not life-threatening. Life-threatening includes broken bones, obviously injuries to your head, possible heart attack. There are things that you're going to call the emergency or go to the emergency room for. Anything that's not life-threatening really should go through an urgent care facility, or lots of plans have nurse lines or virtual care, like a teledoc type situation. If it's not life-threatening, always take a moment to look for another option. And I always recommend actually doing that before the situation comes up. So what's the closest urgent care center and what are the hours? Have that printed out somewhere in your home, or on your phone, so that if that situation comes up, you already know where to go. You don't have to take a half an hour, if you will, to find a place to go.
Are urgent cares 24 hours?
Not always, no.
But some are.
Some are.
Okay.
I lately have been pushing the teledoc type services because having 3 kids, they never got sick between 8 and 5 on Monday through Friday. So in the evenings, in the middle of the night, or on a weekend, what am I going to do if my urgent care isn't open? So to have a teledoc type service, those are 365 days, open 24 hours a day. You can reach out for those urgent situations again and talk to a doctor. They can prescribe medication, and that's also a cost savings.
That is a cost savings. It's also a mental savings as well. I can think about, so I love me as a teledoc. I use the teledoc. I think it's a fantastic program for any benefit plan to have. COVID taught me a lot. COVID, number one, taught me I don't want your germs. Absolutely. Secondarily, I don't want to go into a enclosed 4-walled place where you and the rest of your germs are coughing all over me. Also, kids are loud when they're sick. And then I got to sit in a doctor's office with all of that
Yep.
hustle. Whereas COVID taught me I could talk to my doctor over the phone. I could tell them what was wrong. In sometimes when I talk to employees about benefits, I will use a personal example of a teledoc. One of my daughters gets like throat infections quite often. The teledoc knows that. The last time she got a throat infection, we called the teledoc, and the teledoc was like, "Hey, can you take your phone?" Because we went on a video call with them. Like, "Hey, can you take your phone and like stick it down her throat and then flashlight down there? Let me take a look." And he looked down her throat. And he was like, "Yep, she's got it." They sent us prescription immediately. We went to we went to the pharmacy. And we picked up the prescription. Never once did we leave the comfort of our own home or vehicle, and we weren't exposing ourselves, nor were we exposing her to anything else. So I love teledocs. In plans, how are teledocs billed? Are they typically billed? So how is that cost savings, I guess?
So on a PPO type plan, typically the teledoc, and there are many vendors out there, but teledoc is probably recognizable. On the PPO side of a plan, it's typically a copay. It'll be stated in your plan documents, maybe a 10, or if it's an urgent situation, it might even be 0. Many of the teledoc vendors now also offer behavioral health, so you can do counseling. They also offer dermatology, which can take months and months to get into, and some actually have primary care as well. So they could have different copays, but on the PPO side, it would be most likely a copay. On the high deductible health plan side, the member would have to pay the first dollar, because you can't have first dollar coverage, to qualify for the HSA side. But the costs are typically defined within the plan, so not on a plan document, but asking the carrier for a list of the costs. Typically, they can run between like $45 and maybe $58 for that virtual visit versus going into an urgent care center, which you may still just have a copay. Well, you won't if you're on the high deductible health plan. You'll have to pay for that visit. But again, you're not leaving your home or wherever you may be. It's also great when you're traveling. So when I was traveling, I needed to use it. I woke up with what I thought was pink eye. I was visiting my sister in California who also does the same thing that I do. And I thought, oh gosh, you're going to have to take me to the urgent care. And her first comment was, I don't want to sit in an urgent care. Don't you have a virtual type option? And I do this every day. And I was like, oh, I do.
Fantastic.
And I had never downloaded it before. And it took, 5-10 minutes to put my information in. But when I had done that, it said, we recognize that you're not at home. Is that correct? Yes. Here's some pharmacies in the area that are in your network. in case you need a prescription. Pick one. So
That
I
is
did that.
fantastic.
Took a picture of my eye that was requested. Doctor got on the call. 2 minutes in, yep, I'll call the prescription in, and away it went. And I didn't have to go anywhere.
Isn't
So
that
it was
beautiful?
wonderful.
And I didn't even think about using it when you travel. Unfortunately, I don't get to travel a lot. But if I did, that's actually something, it's kind of a light bulb that went off in my head just then is you gave me an idea. And so, yeah, I love the fact that you can use Teladoc even on the go.
And before you move on, for children too. So I have kids
Yeah.
away at school. I want them to know where urgent care is that's in network. And more importantly, download that app for Teladoc, log yourself in, because my son is notorious for calling me or texting me saying, I don't feel well. I'm on my way to the emergency room. And I can't get on that phone fast enough saying, you are not going to the ER.
Even your son,
Even
as
my son.
as a benefits consultant,
He doesn't listen to mom.
we never listen to our parents, do we? Eventually, one day he'll be sitting down next to you and he'll say, "Mom, remember when we were talking about that one thing? You were so right."
It'll be when he gets the bill,
Probably,
not when I get the bill.
probably. I find myself often telling my parents that they were right.
I know.
Often, I think that comes with age.
Yeah.
Okay, so what are some other things that consumers can do to keep their costs low? I'm thinking things like this: checkups, simple routine things that you should do every year that we don't do. You know, do you have any idea of, just in general, how many people typically do or don't go to the doctor under their plan?
Yes, we look at that every year. And we look at it generally, and we also look at it by each one of our clients. And the overwhelming majority of people of adults do not go in and get their annual exam, do not get their annual blood work, do not go in for age-appropriate testings or screenings. Even for females, the mammograms and their pap exams, those are not utilized like you think that they should be. The percentage of people that are eligible for these that actually do it is very low, maybe in the 30s is a good
Wow.
number, 30%
Go.
of those that are eligible. And
So quick math, 70%. We're talking
Yes.
70% in general don't even do the free services.
exactly.
Guys, what are we
on.
doing? What are we doing? Go see your doctor.
But you know what's interesting?
Yeah.
You look at the children's and they go to everything. It's up into the 80%, 70, 80% get all their services that need to be done. So we're taking our kids in for all the checkups and immunizations if you're doing those types of things. But we're not doing it for ourselves.
Well, I don't want to. I can afford the cost for my kids. I can't afford the cost for me.
It's free.
Well, what?
It's free.
How?
ACA, that we all know and love, has a list of free preventive services. Many of them are male, female specific and age related, and they are all covered for free. For example, an annual exam for everyone, blood work, the mammograms for females, and there's immunizations that are covered, like the flu shots every year.
I got a deductible I got to pay, Kim.
They're free, even on the high deductible
You mean
health
not
plan.
subject to deductible?
Correct.
Wow.
Correct.
So if I'm on a plan that has like a $1,000 deductible, maybe even a plan that has a $5,000 deductible, you're telling me that if I go get my normal checkup, that's not going to cost me anything?
Correct.
Got it. That's amazing. So again, why does only 30% of
That's
the
a
nation
really
on
great
average
question. That's a great question.
get their checkup?
And we try and promote it every year when we do, of course, our once a year open enrollment meetings. We're trying to do more of like communication campaigns throughout the year to maybe roll it out multiple times throughout the year to remind people of that, rather than the one time a year when we are able to kind of go over benefits with people. We forget. And we get busy, and we have kids, and we have soccer, and we have PTA meetings, and everything else that we're doing. Now we're trying to make it easier. So now you can even do many of your like your annual exam, most of the time you can do virtually with your provider or with a teledoc, if you will. Sometimes you need to go in, and I think it's appropriate to go in. But again, it's free as long as it's part of the preventive ACA services.
So, I mean, I know the answer to this, but just why is this important? Why is going to the doctor and getting a checkup every year, getting some blood work done, having a mammogram? Why are those things important?
It's important for two reasons. Most importantly, it is to catch something early that might be happening to our bodies. If it's caught early, the chances of fixing that, if you will, and our lifetime, how long we're going to live and be healthy, is impacted greatly and much more positively if you catch it early. Secondly, treatments when you catch something early are much less expensive than if you catch a stage 4 colon cancer and that's your first knowledge of it. You've got cancer treatments, you've got surgeries, you've got downtime, you can't work, and your likelihood of full recovery also decreases significantly. So if we go in and do these tests, what happens if we go in at 45 now and get our colonoscopy that nobody wants to get, but if you just go do it, it's so preventive. When they find something, it's almost like it didn't happen. They take out the polyp if it's there, they test it. If it's cancerous, they can deal with it then. If it's not, we move on. Versus stage 4, when now you have symptoms and now it impacts financially to the plan and to you, it impacts your daily life and your life expectancy.
Yeah, the colonoscopy thing does scare me too. I think some of those procedures, as maybe we age, are a little scary for us. I can't say that I'm coming up on needing one or anything like that, but it's tough. And so I think
It's kind of great. They give you a
feeling
video of it.
no, thank you. My wife has had several, and you get a whole booklet.
Yeah.
I feel that feeling. I feel that delay, almost I don't want to do that. I don't want to go through that short, I guess, pain, if you will, to have that procedure done because I'm intimidated about
Yeah.
it.
Well, imagine how bad it'll be when you have stage 4 cancer.
But it is a true cost savings.
100%.
Just taking care of that free thing in your benefit plan can help catch something early.
Yes.
Are there any other free things inside of benefit plans that consumers should know about?
The preventive services are the biggest. Sometimes, depending on medication copay structures, there can be a list of generic free medications. Generic is always recommended anyway, though I will say that the majority of companies utilize generic very well. That's something we have taught consumers. Other free services, there's a plethora of free services that each of the carriers offer within your plan that are not like on a benefit summary, if you will. They are located within the website or the portal. If you log into your portal on Blue Cross, if you have Blue Cross, and just kind of poke around in there and click on all the resources, tools available to you. There are weight loss services that can be free. There's exercise services that can be free. There could also be, if you are pregnant, access to someone to speak with whenever you have a question versus trying to call your provider. There could be identity protection services within there as well. There's lots of things you don't think about that could be part of your medical plan and you just don't know.
So you think maybe reach out to either your benefit provider, human resource department, and or even the provider, the website, to find those items.
Definitely. And I would look at it frequently because, again, we don't think about things in the moment until we need them. So just poking around, lots of times there's discounts on gym memberships, or could be something even as simple as a miniature golf or something like that. Just things, if you think about things to get you moving a little bit more, tend to be on there.
Well, kind of the last topic I wanted to hit on here, and I know we've discussed a lot about those costs um, and why some of the things are rising. But I want to talk about some medication costs, and then I want to end kind of with some strategies to help save for your medical cost. But big hot topic right now in the pharmacy industry are going to be things like GPL-1s. For those of us who don't know what GPL-1 is, really quickly, what is a GPL-1?
Well, it's actually GLP-1.
Thank you.
You're welcome. But yes, they are very hot topic, and there's a lot of confusion and misinformation, honestly, about it. For example, everyone has heard the TV ads for Ozempic.
Sure.
And I've heard newscasters and people on the radio talking about Ozempic for weight loss. Ozempic is not for weight loss. It is only FDA approved for type 2 diabetes. So when we're talking about these GLP-1s, that tends to be a very generic discussion about the type of product that it is. But there are specifics between what it was mostly used for, which is for type 2 diabetic control. And then there's a separate approval through the FDA with weight loss. They have different dosages. They're the exact same drug many times, but you cannot go get Ozempic for weight loss, or you're not supposed to be able to. That's another example of prior authorization. So if you go in and you qualify of having type 2 diabetes and qualify for Ozempic, for example, then you can get that drug, but you have to show that you qualify for the drug. In the beginning, when it came out, people, especially influencers, were getting their doctors to prescribe it because there were no controls around it, and they were using it for weight loss. Now, I'm not saying everyone was, but it is effective for weight loss as well. And so anyway, I always like to make a distinction that there are two different sides to this GLP-1 discussion. One is for the diabetic control, and I think every plan covers Ozempic, for example, or that type for diabetic control. That's not the one that we're typically talking about. It is the other side of the coin that is for weight loss specifically. And those are typically a buy-up option on a plan because they are extremely expensive. They can be $1,000, $1,200 a month, and you have to take it every month. Now, that might not sound like a lot, but if you have 20 people taking that drug, it adds up very quick.
It's a big cost burden for the employer as well as the
Exactly.
employee.
And if you're on the high deductible health plan, again, you're paying for that until you hit your deductible.
So that is actually a great way to segue into high deductible plans and kind of mitigating those costs. So a high deductible plan is just like it says. It's a deductible that's super high. Sometimes those out of pockets match, but it is a plan that I know we talk about them, their first dollar plan. So every single dollar you spend for medical service goes into that out of pocket. And I know a lot of times consumers, when we look at our employers' plans and we see those lower premium plans, but they have that high deductible, one of the things that employers try to do is employ FSAs or HSAs or some kind of saving vehicle to help cover those costs. I want to talk about why we do that and why HSAs and FSAs are super important. Could you talk a little bit about your thoughts around those type of savings accounts?
Yes. So it is difficult to kind of portray to people, especially once a year at open enrollment, that a high deductible health plan actually might be the right choice, even though it looks scary. The premiums are less or free, maybe for the employee, it depends. But oh my gosh, I have a $5,000 deductible, which means when I go into the pharmacy in January and I have a prescription that costs $500, I have to pay for that. That's very scary. If you plan for that, though, it helps you get through typically the first couple of months are the roughest because you just don't have that money built up if you're starting fresh. So with a high deductible health plan, that's a qualified high deductible health plan, you can pair that with a health savings account or an HSA. And the HSA is a way to put in pre-tax money to save, to use to reimburse yourself for any of those expenses that you're having to pay out of pocket for. IRS sets limits every year, so you can't just put in, an just magical, massive amount of money. But there are limits. Like I said, it's pre-tax, so it lowers your taxable income. And as long as you're spending that money on qualified medical, dental, vision type of expenses, you can spend it pre-tax or tax-free as well. Employers can contribute to the HSA. That does count towards your maximum for the year. And we always encourage employees to contribute as well, even though it might seem like, well, I'm even paying more then. But if you set up a dollar amount, whether it's the maximum, to fund the maximum was always a great idea, but I don't fund my 401k at the maximum. I know it's a great idea, but I do put some in. So I get that maybe we don't go to the maximum, but to pick an amount. And what's wonderful about the HSA is you don't lose that money at the end of the year. So if you haven't used it all, it rolls into the next year and you can add more to it. The money is supposed to be there to help you with that deductible. But also high deductible health plans with an HSA are really great for any age consumer. So down to, an 18-year-old that's maybe at their first job, all the way up to someone that's about to retire, because you can use your HSA funds on whatever you find important. Where the PPO plan tells you what you can get and how much it's going to cost you. On the high deductible health plan, you choose how you're going to spend that money. Maybe I don't go to the doctor this year, except for my free annual exam, of course, and I didn't end up spending any of that money. I would like a new pair of glasses and contacts. My vision plan doesn't cover both. So I can take that money out and get those contacts that I wasn't able to get. I can also spend for Crown that I maxed out my dental benefits for.
Well, what's really interesting is that money in your HSA account that stays with you, like you said. But I tell a lot of folks when I talk to them about benefits, think of it this way: you paid your medical provider, you paid your carrier so much money in premiums. Mm-hmm. Just to say you had a specific plan, a non-high deductible plan, you paid so much in premiums, and you're going to pay a lot in premiums to have like a PPO style plan that's not a first dollar HSA qualifying plan. And then I look at those premiums for the high deductible plans are pretty low. And I think of it like this: if I were to be on that PPO plan and I'm paying those high premium costs, right, and I don't go to the doctor at all, can I petition the carrier and say, hey, I didn't use your service? Can I have my premiums back?
Wouldn't that be great?
Wouldn't that be great? What are they going to do? They'll probably laugh me off the phone.
Exactly.
They won't even take my phone call. And so what I tell folks is, in an HSA situation, you be the carrier. Pay yourself the HSA money. Put it into your bank. Because if you don't use the money, the HSA funds, you can go petition yourself and say, hey, Chris, I didn't use the HSA funds. Yep, it's still there. I can use for next year. It's almost like I'm paying my own medical way. And in the years that I don't need the medical, I'm saving it. Exactly. And so in the years that I do need it, I've got it ready. I've got it available for me. I remember being on the high deductible plan in my first year on a high deductible plan. It was kind of scary. I had no HSA, and it did take time to get that balance up. Another item too, with folks when they think about an HSA and that catastrophic thing that happens, maybe they don't have all of their deductible in the HSA account. One of the things that I found that kind of enlightened me a little bit was when you go to the doctor, let's say you have something catastrophic happen and they're going to bill you, right? Why not have the person bill you, or the doctor's office bill you on a monthly basis and bill you at a rate a little bit less than what you're putting into your HSA each paycheck or each month? That way, when you get your bill in, you've saved the money tax-free. Guys, tax-free. The government doesn't get any of it. Completely free for you. It's for you tax-free, and I can save it year over year. So that way, year 2, year 3, I've got my deductible ready to go. If something were to happen, no sweat. Here's my debit card. Here's my HSA card. Please use it. And I'm done for the year. Yeah. And it's great. And then I can go do all the rest of the stuff that I was just delaying because I didn't want to pay for it.
You can, but shop those services.
Always shop those services. Always shop those services. Well, we are coming towards the end. Kim, I really appreciate you coming in today and talking about benefits with us. I'm hoping that our listeners were able to get some good information and take some finer points away. Like, Go to the doctor.
Yeah.
Get your free services. Okay,
Number one.
just do it. Just do it. So I do appreciate you coming in. Thanks a lot for this.
Thank you for having me.
And again, thank you all for joining us at Worth a Listen. I hope it was worth your time.